Well, the excitement of back to school may be overwhelming for kids, especially if they can't see clearly. Believe it or not, nearly 25% of all school-age children have vision problems. 12.5 million school-age kids can't even see the whiteboard. According to the CDC, vision problems are the single most prevalent disabling condition among American children. Let's clear things up with Dr. Derek Holt. He's a pediatric ophthalmologist with IQ Vision Care. How are you, doctor?
Great. Thanks so much for having me.
Well, thank you for being here. This is very important because we all need to know how often should a child have his or her eyes checked, and at what age should we even start doing that?
Well, actually, an ocular evaluation examination is an important part even of the very first exam of a newborn.
Oh.
And eyes should be assessed at every well-child checkup by your child's pediatrician.
Okay. I got to ask you something really quickly. Sometimes we see these really young babies with glasses.
Yeah.
This may be a dumb question, but how do you know they need glasses when they're that little?
Yeah, well, we have to be aware of the possibility that that can happen and have kids referred in to see us if there's a concern at one of those kind of screening exams in the pediatrician's office. In some cases, the child may have other medical conditions that can be associated with eye problems, and so that kind of puts them on the radar.
Okay, because they can't talk. You know, a 9-month-old can't talk.
That's right.
Okay.
But then we can evaluate their refractive state without them giving us input and kind of tell what their refractive area is and whether or not they need glasses.
I've always wondered about that. All right, why is it so important for kids to get an eye exam right before returning to school?
Well, as you discussed, you know, when you introduced the segment, eye problems are much more common than people realize. And if you don't kind of have that on your radar, thinking about the possibility, then your child may go into school with problems that can affect their learning. So if anything comes up in their well-child checkups, or as you talk with teachers, or you discuss with your child how they're doing at school, it's definitely best to have them come in for an eye exam and make sure that there isn't a problem.
What are some of the symptoms? How can we tell?
Well, of course, there are things like they're sitting close to the TV, they're holding things close to their face. A teacher tells you that they think that the child may be having a problem seeing at school. Any child that is not reading at grade level should have an eye exam to make sure that it's not due to a visual problem. There are some other things that can be signs as well, things like maybe turning or tilting their head. Sometimes a child will close one eye or rub their eyes.
Okay.
You may see something more obvious like eye shaking or eye misalignment. That would definitely be a reason for them to be seen.
Now, what is the difference between a pediatric ophthalmologist and then an ophthalmologist?
Okay, so ophthalmologists are eye specialists that are medical doctors, and within the field of ophthalmology there are subspecialists that deal with specific problems with the eye. And at IQ we have cataract surgeons and we have all of the major types of eye specialists. I'm the pediatric specialist. That means that I've had additional training, fellowship training, to deal with the diagnosis and management of eye disease in children of all ages.
Because they're different.
They're different,
I
definitely.
mean, you've given Freddie an eye exam, and it's completely different than if I were to get an eye exam, and that's why it's so important to go to pediatric.
And you need to do, the exam for a newborn is different than for a 6-month-old, is different than for a 5-year-old. And so you definitely need kind of some specialized training for that. All right,
doctor, give us some tips on how to maintain our kids' vision healthy throughout the entire school year.
Okay. Well, so first of all, it's a good idea for parents to just be aware of the fact that vision problems can happen, and it can be difficult for children to tell you that they're having problems with their vision or even to appreciate it themselves. So kind of be on the lookout for the things that we discussed. It's also important to maintain kind of preventative measures. Eye injuries are very common. There's over 40,000 eye injuries in the U.S. every year, and several of those happen to children, unfortunately. So doing things like being aware of what your kids are playing with, making sure they're not playing with toys that can be dangerous, that they're using age-appropriate toys, watching kind of even table edges,
Oh,
especially
yeah.
that are low with toddlers, having railings on stairs and things like that are important. BB guns and things like that are not a good idea, especially if they're unsupervised.
Yeah.
So just kind of being aware of ways you can make your child safer.
And sometimes they look super cute. We think, oh, look at that little kid with sunglasses, but it's important for them to wear sunglasses.
It is,
yes,
definitely.
Yes.
Yeah.
Now let me ask you this before we go. If the parents wear glasses, what's the percentage, or what's the likelihood of their children needing glasses?
Yeah, I mean, the percentages are kind of
Okay.
complicated, depends on the details, but there's definitely a significantly increased
Okay.
probability that the child will need glasses.
Okay.
And so you really need to kind of be on the lookout for signs that there might be problems. And I've had several parents come in with that kind of family history, just wanted to make sure that things were okay, and we picked up a problem that needed to be treated.
Oh, good.
Yeah, so definitely
good.
have a high index of suspicion if there's family history of a need for glasses or any family history of any other eye problem in childhood.
Well, it's important to make your appointment. Call the number that you see there on your screen, 486-2000. For many people, school has already started. Doesn't matter, but if your kid is going to start school here soon, get him into the eye doctor, Dr. Holt, so he can check him out. Thank you, doctor, so much
thank
for
you.
being here. You're at IQ, and it's IQVC.com.
That's
is the
right.
website.
Yeah.
Okay, thank you so very much.
Well, let me add my wishes for happy birthday.
Oh my gosh, that's so sweet. Thank you so much. It is my birthday. I'm very excited, especially when all my guests tell me that. Thank you. I appreciate it. Still to come here in Central Valley today, we're going in the kitchen, cooking with corn. Just how easy it is to add the sweet veggie to your recipes. But if you don't want to spend time in the kitchen, then all you have to do is call the sweet experts to help you out. We'll explain when we come back.